Thank you all for joining us this afternoon. My name is Max Rogers. I'm the CEO of the Neurological Alliance of Ireland, which is the umbrella group for nearly 40 neurological charities. This online meeting is to highlight the service needs of people with neurological conditions from throughout the South East. Approximately 1 in 6 people across Ireland lives with a neurological condition, and that equates to over 80,000 people across the South East living with a neurological condition, which really isn't surprising when you think of all of us know someone living, at least one person living with these conditions. I want to extend a warm welcome this afternoon to the TDs and local TDs and councillors who were able to join this meeting, and to encourage them to introduce themselves using the chat, just so that we know who is represented this afternoon. Just to note that this call is being recorded, and a recording will be sent on to any of the TDs and councillors who couldn't make the meeting today. You will hear shortly from Dr. Orla Toohey, the consultant neurologist in University Hospital Waterford, who is very kindly joining us, and then from people living with neurological conditions from across the South East to outline their own experience of trying to access services with the condition. I want to highlight that the upcoming NAI pre-budget submission, which will be published on the 24th of June, will include a specific focus on the South East. And I'm just going to summarise our ask before we hear from people this afternoon. So our first ask is for the Minister for Disability, and that is to fund a community neurorehabilitation team for the South East. The South East is now the only region in Ireland still awaiting funding for a community neurorehabilitation team, with a commitment in the current programme for government to complete the rollout of these teams nationwide. These teams provide essential therapies like physiotherapy, speech and language therapy, and neuropsychology to people living with a wide range of neurological conditions. Secondly, we're highlighting to the Minister for Health that Tipperary Hospital is now the only Model 3 hospital across the South East that does not have a neurology service. And again, that's despite the National Model of Care for Neurology Services published a decade ago this year, outlining that all Model 3 hospitals should have a dedicated neurology service. So I'm going to hand over now to Dr. Toohey, who's the consultant neurologist from University Hospital Waterford, and she's going to briefly outline the impact of the people she sees in her clinics in the South East living with neurological conditions, of the gaps in care. And then I'm going to hand over to people with lived experience from across the South East to come in and join. I'll just call on their names when Orla has finished. So Orla, if I can hand over to you.
Thanks, Mags, and thanks for the invitation to speak today. So I see some familiar faces on the call, but if anyone doesn't know me, as Max said, I'm Orla Toohey, and I've been working as a consultant neurologist in Waterford Hospital for nearly 4 years at this stage. I moved back to Ireland, having been a consultant in the NHS for 3 years prior to that. So as Mags outlined, I suppose UHW is a Model 4 hospital that provides sort of neurology services to the South East region. Catchment area encompasses a population of nearly 500,000, and again with the service based from UHW. So within the service at the moment we have 4.2 whole-time equivalent consultant neurologists. There's 5 nurses, 3 of whom have just started within the past 3 months, and have been recruited from in-house in UHW. So they're being trained up to be neurology nurse specialists to cover the main disease areas of MS, Parkinson's, epilepsy. But as Mags had referenced, the model of care for neurology document published 10 years ago at this stage outlined I suppose what the expectations for a neurology service should be, including access to specialist clinics, but also that within the Model 3 hospitals within the region, that service users and patients who attend those hospitals should have access to timely neurology review. And thanks to the work of the NAI and advocacy work, there will be someone starting imminently in Wexford Hospital, again providing sort of outreach or spoke neurology services there, and then attending at UHW as well. But Tipperary University Hospital, I suppose, doesn't currently have that service, and so there's no need there for patients who are admitted to Tipperary University Hospital to have the access that patients who end up being admitted to other centres get in terms of early access to specialist inpatient review. Again, I suppose it's across the board in Ireland that the staffing levels are not sufficient to meet the needs of the population. I suppose if you were to take the population of 500,000, estimates are that you need 1.6 neurologists per 100,000 population. So again, we have 4.2. We should have 8. And similarly from nursing points of view, so MS is my subspecialist area, so I know that to meet the needs of a population of 500,000, you would need 3 MS nurses kind of covering that region. Again, we're down in terms of access to health and social care professionals within the hospital setting. So actually the only allied health professional that we have in the hospital is half, a whole-time equivalent of occupational therapists. So even within UHW, which is your Waterford centre, we don't have any neurophysio, speech and language therapy, dietetics, or access to psychology. And a lot of our patients, I suppose, are living with chronic neurological conditions. So as well as being, able to access those services within the hospital setting, there's a vital need that the patients are able to access those services within the community. And so we stand behind Mags in advocating for community neurorehabilitation teams to allow people to live well within the community. And so that some of their needs can be managed without needing to access services through the hospital. So again, as she said, we're the only region that doesn't currently have either funding for a community neuro rehab team in place. So that's another major sort of critical unmet need. Access to diagnostics, again, has always been a struggle and a challenge. And again, within the hospital setting, we're probably one of the only centres that don't have access to inpatient neurophysiology testing. What neurophysiology encompasses is access to EEG, which I tell my patients is a brainwave tracing recording, and it's used to diagnose an epilepsy, for example, in people who have presented to hospital with the first seizure. So currently we have to refer patients out to centres in Cork or Dublin to access that testing, with wait times of over a year for an outpatient EEG. It also creates a safety issue for patients who are admitted here who might have severe seizures, and in trying to manage those patients safely, we should have that service on site. So that's again one of the major areas that we've been advocating for funding and for development of a service here. So I suppose I told Max earlier on I could probably talk all day about the service needs that we have, but dividing them into things like staffing and infrastructure and services such as diagnostics and neurophysiology testing within the hub, and then also adequate provision of neurology service to each of the spoke sites in the Model 3 hospitals, and then funding an adequately staffed community neurorehabilitation service. So I'll probably wrap up there if that's okay, Mags, but again, happy to take questions and things if there are any that come up along the way.
Thank you, Dr. Tilly. And I know we've a lot of people looking to get in on this call, so we'll come back with questions if we have time in a little while. Thank you so much for that. I know, as you're saying, there's so many gaps, and we're just trying to focus in for this current pre-budget submission on just a few of those. At this stage, I want to invite in people with lived experience from across the Southeast. I know a couple of people trying to get on the call, so I'm just going to call on people that I know are in the call and that I promised the opportunity to speak. So maybe if I can go to Nicola, if you're on the call and you want to, you're very welcome. Can you hear us okay?
Yeah, can you hear me okay?
We can.
Yeah, so I'm from Rosslare down in Wexford, and I have muscular dystrophy. It's limb-girdle muscular dystrophy. And at the moment, my neurologist is based up in Beaumont Hospital. So it's pretty far away. And what I really would love is having something in the Southeast region that would be for rehabilitation for myself, like for speech and language therapist, a dietitian, something that I don't have to travel so far to get, because I know myself, when I travel all the way up to Beaumont, it's because my posture wouldn't be great. So I'm tensing up my back. So the journey's really long for me. And so I have to tense up my back. So I have to sit up straight so I don't impose my posture, because I don't want to, sometimes when you're sitting too long in your wheelchair, that if you don't have to travel that far, it will be a lot easier to have something in the Southeast region for rehabilitation, for physio, someone that understands the needs of someone with a neurological condition, I think would be brilliant. And I know myself when I went up before that they cancelled the clinic on me, but I didn't know until I actually got there. And it's not just easy just to hop in the car and, you know yourself, go up and then you're told it's cancelled. But you know yourself, like, I mean, it's too far, and something's definitely needed in the southeast, especially would benefit me especially.
Thank you so much, Nicola, for coming in around that. As I said at the start of the call, the Southeast is the only region in Ireland that hasn't been funded for what's called a community neurorehabilitation team, and that's a specialist team comprising physiotherapy, speech and language therapy, neuropsychology, and a range of other disciplines that supports people, provides intensive neuro rehab to people with neurological conditions. And these teams have been funded all around the country. 9 of them are promised, 8 of them are funded to date, except the Southeast. So that's a really strong call in our pre-budget submission this year. Thanks so much, Nicola, for coming in and sharing your experience. I'll go to Irene.
Hi, how are you? Good afternoon, everybody. My name is Irene Delaney, and I'm here to speak not only from my own experience, but also on behalf of many people living with neurological conditions in the Southeast. I have epilepsy and require specialist neurology services to manage my condition. When I first needed the support 30 years ago, there was no local option available to me. I did see a brief neurologist in Waterford, but he was, I vaguely remember he was very old, and then I was transferred to Cork. And then when I had the option after 10 years going to Cork, I got the option to be transferred to Beaumont. So that's where I go now. And while I was fortunate to receive the support I needed at the time, the journey came at a cost. Travelling to Dublin at the moment is exhausting, and often experience fatigue for several days afterwards. For someone living with epilepsy, fatigue management is extremely important. Managing my energy levels is a key part for staying well and participating in everyday life. Long journeys for healthcare appointments can make that much harder. My experience has made me think about others across the Southeast who face similar and even greater challenges. I don't think I have a big challenge. I'm not in a wheelchair or anything like that. Through meeting and speaking with people affected by acquired brain injuries, I have learned that many survivors leave hospital grateful to be alive, but then struggle to access rehabilitation support. They need to rebuild their lives. Many are living with hidden difficulties such as memory problems, fatigue, concentration issues, emotional challenges, and difficulty returning to work, education, and community life. Recovery does not end when a person leaves hospital. In many cases, this is when the real work begins. People should not have to travel long distances or fight to access specialist rehabilitation services. They should be able to access support close to home where they can focus their energy on recovery, family, work, and community participation. This is why I am supporting the call for community neurorehabilitation teams in the Southeast. This investment would not just improve services, it would improve lives dramatically. It would give the opportunity to maximise their recovery, maintain their independence, and participate fully in their communities. Today, I am asking you to support people living with neurological conditions and acquired brain injury by investing in community neurorehabilitation teams in the upcoming budget. Thank you.
Couldn't have said it better myself, Irene. Well done. That's really good. You made a really good series of points there. Thank you so much. I'm going to go in a minute to Natasha that works with you, Irene, but just first I'm going to go to James. James, if you want to come in, you're living in Tipperary and just in around the neurology service in Tipperary and also the Southeast team.
Yeah, that's right. Thanks, Max. So I'll just give a bit of background on my own experience. I have multiple sclerosis. I'm sitting here now as I speak to you in a wheelchair. My neurologist is based in Tala, and I've been going to to that neurologist for the last number of years. To go up there, I have to take a day off work, and like Irene said there, you'd be exhausted for days afterwards. So it's just a big push for me. When I'm told I'm due a neurologist catch up once a year or maybe more, my heart sinks, like, because I know I'm going to have to drag myself to Dublin to do it. You might say Cork or Limerick is maybe closer for you, James, but the roads to Limerick and Cork are not good, like, and if you have to drive into the city centre, it's added stress. Whereas I find going to Tala is actually on the outskirts of Dublin is actually quite simple. And it's just that it's just so far away, like it is a real drag. But in saying that, I had stem cell therapy back in 2021, and following the therapy, I had neurorehabilitation. So just on the second point there, I experienced neurorehabilitation sources in Peamount, and I was lucky enough because my neurologist in Tala was actually the consultant neurologist in Peamount, so she was able to push me there. So following the stem cell therapy, and it was brilliant. Like before I went for that neurorehabilitation, I didn't even know it was available, but it's absolutely phenomenal. You don't realize how good it is. So like when you get admitted to neurorehabilitation, now I was an inpatient, but I had access to physical therapists who really know their game. They know the MS inside and out, all the exercises you need to be doing, and access to dieticians. And I heard actual psychologists. I had access to really in-depth counseling sessions, which is really important for everyone. But definitely, I find it really helpful. But I mean, on a day-to-day basis, just MS down here in Tipperary, I know nothing about neurorehabilitation sources. I know nothing about that, and I guess a lot of people in the southeast don't even realise that we don't have that service, and they don't even realise how good it is. Lads, we made billions last year of a surplus from receipts, corporate tax receipts. If we can't get one of these now, when are we going to get one? Because now is the time for it to happen. We are really missing out. And yeah, my heart does go out for other people. Like Irene said there, my heart goes out to other people who are in a worse condition than myself. They really do. I actually feel blessed that I'm as good as I am, and I'm able to come on this call here and voice this. But there's other people who need this service much worse than the people you're seeing here in this call. These are the people who are able to come on the call and talk. There's a litany of people who are not able to come on the call and talk and tell you how hard it is for them to go every day to their neurologist, whether it be going up to Peamount from Wexford, or sorry, going up to Beaumont from Wexford. That's not on, lads. We can do better than that, and we deserve better than that. And like I said, people don't even realise how much you need neurorehabilitation. You need it. But anyways, that's all I'd like to say. Thanks, Max.
Thank you so much, James. I think you made, again, like our other speakers, you made the point so clearly. And I suppose it is that real regional inequity that these teams are now available in 8 other regions of the 8 other parts of the country. And the Southeast is the one last team that hasn't been delivered. And just to say that this is a commitment in the current programme for government to complete the national rollout of these teams. So as I say, the pre-budget submission that we will launch on the 24th of June will call for a community neurorehabilitation team for the Southeast. And the other aspect that you've highlighted there, James, just in relation to Tipperary Hospital being the only Model 3 hospital in the Southeast that doesn't have a neurology service, and again that the impact on people travelling long distances to Dublin, to Cork, for a service that could and should be available locally, that is available locally in other parts of the country and people in other areas. I'm just looking who has still to speak. Natasha, I might bring in yourself as a service provider working with Irene, if you want to come in there and talk about the organisation and the work that you do, and also what you perceive as the gaps locally.
Yeah. No problem. Thanks, Mag. Good afternoon, everyone. And Mag, thanks very much for the opportunity to speak today. So I'm the community and case manager for Wexford and Waterford with Acquired Brain Injury Ireland. I suppose really I see firsthand the impact that a brain injury can have on individuals, their families and communities across the Southeast. Every year people acquire brain injury through stroke, fall, road traffic accidents, brain tumours, infections and other neurological events. And I suppose like many do receive excellent acute care and specialist intervention in hospital settings, but I suppose once they're discharged, there can be a significant gap in the rehabilitation services as well. So too often individuals leave hospital with ongoing rehabilitation needs that relate to memory, to fatigue, attention, communication difficulties, emotional adjustment, mobility, and also as well, sorry, returning to work and education and community life. So I suppose really once their medical treatment it's complete, their journey, like their recovery journey, it's far from over. And one of the most common experiences that we see are people falling between the services. And they're no longer considered acute enough for hospital care, but they still required specialist rehabilitation support. And families they're often left like trying to navigate like a complex system while supporting their loved one who like their lives are just changed so dramatically. Many people are unsure where to turn, and those valuable rehabilitation opportunities can be lost during this really, really important period. So I suppose really, as many people would know, like brain injury, it's often described as a hidden disability. So like the person may physically look well, but they're struggling every day with what I mentioned, like fatigue and memory difficulties, poor concentration, and sensory overload as well. And these challenges can really, really affect relationships, employment, education, and their independence long after discharge from hospital. So I suppose we know rehabilitation is most effective when it's lived from a person's own community, and that a community neurorehabilitation team would provide coordinated specialist intervention at the right time and in the right place. And it would also support individuals to maximise recovery, to maintain their independence, avoid hospital admissions as well, and to achieve a better long-term outcomes. And I suppose most importantly, it ensures people don't fall through the gaps between the acute care and community living as well. So, sorry. So the Southeast, like as we know, it remains underserved in this regard, and the people living in our region, they deserve the same access to specialist neurorehabilitation services as those everywhere else in the country. And that investment in a CNRT, it would not only improve the quality of life for individuals and their families, but would also represent a cost-effective investment in recovery, independence, and long-term outcomes. So again, I'm just asking for support to ensure that people in the South East have equitable access to specialist neuro rehab services, and that the funding is allocated in the upcoming budget for development of these CNRTs in the region. Thanks a million. Sorry, my voice is not the best today. I hope you could hear me all right.
You're okay, Natasha. And again, thank you so much for your powerful words. And just to say that yourselves in Acquired Brain Injury Ireland and representatives of the nearly 40 member organisations of the Neurological Alliance provide really vital services for people living with neurological conditions all across the Southeast. And I'm going to bring in a number of those organisations that I see here now just to talk again about the services they provide and what they perceive as the gaps in the region. So Eamon, I might go to yourself. I know Lillian isn't able to join us on the call, but I know that you can speak for F&D and the gaps in services in the Southeast.
Thanks, Mags, and good to meet everyone. So my name is Eamon McPartland, and I'm the founder of F&D Ireland, and that support those with functional neurological disorder condition. I live with myself, and just unfortunately Lillian isn't on the call, as Mag said today, just to give a first-hand experience of someone that lives in Waterford in the southeast. We have peer support meetings around the country, so I try to attend them myself personally as best I can. And we had a meeting there in Waterford in April, and I got to understand the extreme challenges that people face there with functional neurological disorder, but all neurological conditions. And obviously, Dr. Orla Tui mentioned there the challenges in relation to the services in Waterford, and many of those people have to travel to Dublin, just exactly as the other people here with lived experience have shared. And another thing, I suppose, just to highlight there, I think James mentioned there, just in relation to Tipperary, we also would have a meeting which is slightly outside the southeast, but in Mallow, where people from South Tipperary would attend. And I suppose the frustration there is that people in North Tipperary have access to community neurorehabilitation team, albeit based in Limerick, which is a bit of a travel journey even for those in some place of North Tip, but those in South Tip have access to no team. So you basically could have someone a mile apart in the same county living with whatever neurological condition and not accessing a team, which is ridiculous in this day and age. And as Mags and everyone has said, it's the only area in the country that hasn't yet funded a team. And as many people would know here, not just my role with F&D Ireland, but on the lived experience member of the board of the Neurological Alliance of Ireland, how passionate I am about these community neurorehabilitation teams having equitable access for everyone and everywhere in the country. And I live in an area which has not yet got a team, even though it is funded. So I completely understand the experiences that's being shared here today. So thanks, Max.
Thank you, Eamon. That's a really stark point, just around living a mile up the road. You're able to access the community neurorehabilitation team in the Midwest. But again, South Tip doesn't, and the entire Southeast doesn't have access to a team. Caroline, I'll bring in yourself from PSPA.
Oh yeah, I suppose the big thing is the access, you know, is a big problem as well. A lot of our people would be elderly people and over 62, generally speaking. And a lot of people could be even in their late 70s or 80, and sort of bringing someone up to Dublin very often means that that person has to somehow either get a family member to take off work, or actually some people will actually try and come up by train themselves with a wheelchair. That's not easy to get to Dublin, and then they have to wait for a long period of time. And the problem with the PSP, even if somebody's mobile, like, I mean, they can fall without warning at any given time, and that puts persons at very high risk. Also, the capability, because of the nuances of the condition, actually to be active for that length of time is particularly difficult. So having something in the local area would make an enormous difference. Also, the condition is so variable in each individual that, you know, regular monitoring is really important. And if you're not having access to services with PSP or CBD, you are losing your voice, you may have swallow issues, and these things are very advanced. So what we provide in the local area really is because of a small number of people, we actually provide services in Limerick where people can meet and talk, and that would be the biggest challenge they have. Like we even have people coming up from Clare to some of our meetings because they want to know more, they want to understand the condition, and they find that people just don't have the knowledge, and without the knowledge they're not getting what they need on time. So I think having a neurological team in the local area means that they can get the service when they need them, not when it's too late. And you know, it's in our condition, it's about quality of life, and you don't have any quality of life if you have no team in your local area.
Thank you so much, Caroline. Annelle, do you want to come in there? I think you're still, yeah.
Yeah, sorry, no, I was on mute there. No, I don't have anything in particular to add. I suppose I think the issues have been highlighted very well. And it is, you know, when we look at the way services are moving and reconfiguring under the new areas and sláinte care and all of that, it is all about providing intervention as close to home as possible. So, you know, that I totally support, I suppose, the quest for getting services closer to people's homes.
Thank you. Lorna, I'm going to surprise you there and come in and just ask you, I know you were involved in a previous campaign for a neurologist for Wexford Hospital. You were fantastic in that campaign. It was a successful campaign. Just if you wanted to comment on the lack of a community neurorehabilitation team for the Southeast, and why you just feel, you know, as someone living with MS, why you feel that's particularly relevant to yourself and people like you in the Southeast.
Firstly, thanks a million, Max, for the surprise. I love surprises. And I'd love a surprise of a neurological team in the Southeast. It would be absolutely amazing. Even just getting a neurologist into our hospital part-time is amazing achievement. But now we need the services to back this. I was quite ill last year, and only for I worked with some of the team in Waterford, I wouldn't be back to the strength I'm at today. And it just goes to show people can regain something that they have lost if we have these teams. But when these teams don't exist in the Southeast, we are at a complete disadvantage. None of us want to depend on the services or become burdened upon the services. So the quicker that we get an intervention in what our illness may be, or our disease, whatever it is, that the sooner we have some sort of an intervention, the quicker that we can be helped and progress and make improvements in our life and get on with our lives. But it shouldn't in Ireland come down to where we're living. In this day and age, we should actually be just, these services should be in our doorstep. Even hearing about Tipperary not having a neurologist breaks my heart after all I went through, you know, campaigning with yourselves 2 years ago. And to hear that there is still hospitals without neurologists in this day and age is disgraceful. That's my outlook on it, Mags, and thanks. And I'm listening to everybody here. Well done to you all.
Thanks, Lorna. And as you say, it's no more than was promised. I mean, the commitments we're looking for here today, the delivery of a community neurorehabilitation for the South team for the Southeast, and a neurology service for Tipperary Hospital. These are all clearly outlined in healthcare policy. They're not something that we've just come up with. They're very clearly outlined and committed to, not only within neurological and neurorehabilitation strategies, but also within the current programme for government that commits to the nationwide rollout of community neurorehabilitation teams, and also to investment in neurology services. So I think I've given everyone a chance to speak there. I just want to open up the floor if any of the local TDs or councillors want to make any comment on what they've heard this afternoon. They're taking it all in. And just to say that this call has been recorded and will be sent to any of the councillors and TDs that couldn't make the meeting this afternoon. And we will be launching our pre-budget submission on the 24th of June, Wednesday the 24th of June, that will include a number of asks, but specifically focusing in on the Southeast for a community neurorehabilitation team and for neurology services for regional hospitals. And Marie, you wanted to come in. I might have overlooked you, my apologies.
Hi, yeah, it's great to hear so many people advocating for this. I have cervical dystonia, and I suffered a lot. I live in Wexford, and I suffered an awful lot and was admitted to hospital many times from 2000, and I was in Wexford in 2014, and I lost use of my arm and I couldn't hold my head up, and nobody knew what was going on with me. And I was just put on like a list of medication that was knocking me out. I'm waking up screaming, and I saw no neurologist. And then I had to face into another episode again. And then the tremor started, and I had the tremor for like 2 years before my GP even referred me to a neurologist. And then I had to wait another 2.5 years before I even got an appointment to see a neurologist. At that point, I couldn't read, couldn't concentrate whatsoever. I had no control of my head, and it was just so painful and exhausting. And I was going through bladder cancer as well at the same time, and the stress of the head was just crazy. I never knew about neurological disorders. And even last year, I had a really bad year, and like my GP is not able to treat me. I refused to go to Wexford Hospital again because I was just pumped with morphine and knocked out, and nothing was helping, you know. And I had no one to turn to, even though I had the neurologist in Waterford. I was on a neurologist in Waterford. He stopped doing the botulinum injections that I was getting, and to help it, because he freaked out that I might be having a reaction. So literally he stopped treating me, and just held his hands up, and I'm sitting in his office crying with nerve pains shooting out my arm, like screeching, and spasms in front of him, and he couldn't help me. So the knowledge and understanding of dystonia is not there. People don't know about it. Doctors don't understand it. There's not enough care for it. At the moment, the neurologist I had has retired, and I'm a neurologist. I'm waiting on a new one to come to take over. And so I had someone who's just a different neurologist who doesn't really deal with dystonia or movement disorders to give me injections there a few weeks ago, but they're not working too good because the tremor is kicking off so much more, and I'm getting more spasms now in my body and my legs, and I've no one to turn to. There's no support.
I'm sorry to hear about your experience, Anne-Marie, and again, that you feel so far away from everything, and the lack of local supports. Certainly that. Thank you for sharing your experience. Maureen, you wanted to come in there?
Yeah, hi. I represent a taxi foundation Ireland, and I just want to bring in the fact that anyone with taxi has to go to the taxi clinic in Tala to be seen, and as of today, the waiting list for is 2 years. And that's just to get in the door of the clinic, not to get you any of the other services you need. And I think that needs to be addressed. While it's fine for people to go to Dublin, to the major hospitals, the wait time is horrendous, and then the follow-up service is horrendous. And I think we really need something here in the southeast. I mean, if we have 80,000 sufferers in the southeast, why are we waiting for a service that's so badly needed?
Thank you, Maureen. Thanks for speaking in support. Eamon, you want to come back in there?
Yeah, just very quickly, and it's just on my other condition, Mags, and probably Anne-Marie doesn't know, I also live with cervical dystonia, Anne-Marie, so I completely resonate. It was originally my original diagnosis, and I then was diagnosed with FND later on, a number of years later, so I live with 2 neurological conditions. But I'm Anne-Marie, like yourself, I'm in a different part of the country, but I have to make a 6-hour round trip to get my Botox injections to Dublin. I'm fortunate, though, that they thankfully are helping me, but I completely understand what you mentioned there, how important it is to get that specialist intervention, which is very similar to people with functional neurological disorder, where we just got the starting of the first ever FND clinic in the country in Dublin. And I think that needs to be considered as well in relation to the outreach that's provided to the southeast, is that you've got those services that you can avail of and to get your Botox injections locally.
Thank you, everyone. I think we've given everyone a chance to speak at this stage, so I'll give you back a little bit of your afternoon. I just want to sincerely thank everyone who's come on the call today and shared their experience. I know it's not easy to do, and you're very much, speaking to a supportive grouping here. We will do our best to get this messaging out. As I say, we will take this recording and share it with the local TDs and councillors who couldn't attend today. And we will be launching our pre-budget submission, as I say, on the 24th of June in Dublin. And we will be making as strong a request as we can to address this regional inequity in the southeast, that services that are taken for granted and available in other parts of the country are not available to people in the southeast. So thank you all for sharing your experiences. We will do the best we can. We will for joining us this afternoon. My name is Max Rogers. I'm the CEO of the